Hi everyone, I'm Amy from the marketing team, and today I'm with a very special guest. This is Kwaku Boafo.
Hey,
Kwaku, thank you for being here with us.
Hey, nice to be here, Amy.
So we have a few questions for him. If you have any, feel free to leave them in the comments and he'll answer them for you. My first question for you is, what is your job title?
So my job title is a research and project administrator for the AROW Health Link.
Nice.
And AROW is the Armed Prior Region Ottawa West Health Link.
Okay, awesome. And what inspired you to get involved with the health links?
I had worked at a previous health link for a few months prior, and it just seemed to be an organic transition. I met with Josh, and he sort of described what the role would be, and it was going to be about technology and patients and sort of seeing how the two could merge, and I found it pretty exciting. So yeah, we made it happen.
That's awesome. And now working with the health links, what would you say are some of your biggest challenges there?
Wow. Well, Health Links follows an embedded healthcare model. So we sort of teach a methodology. The Health Link approach is a methodology. So the challenge with that is, oftentimes you have people who are used to doing things a certain way, and you bring in this new methodology for them to adopt. And it's challenging because, they're very good at what they already do. And here you are adding something different, thinking that it's going to help make the jobs easier, which it kind of does. Yeah. And especially from a client perspective, it really helps clients. But it's almost like an analogy of, let's say you're playing basketball, right? And you've been practicing your 3-point shots all day. You find the sweet spot, and finally you're making all your shots from the sweet spot. And then your coach comes and says, okay, you know what? I need you to shoot from the left side, and not even with your right hand, but shoot with your left hand. And it's kind of like, but I just figured this out. So it's a challenge, but people are getting on board, and we're seeing the change that we're making in the community. So
yeah, that's awesome.
That's what counts.
Yeah, for sure. And so you use a TouchAway with your clients, care coordinators?
Yeah, with our clients, with our care coordinators. Me personally, I spend a lot of time in the dashboard. Okay. So more on the back end of the app. Yeah. I set up clients. I set up profiles. I work in CRIS. And CRIS, for those who don't know, is the Lynn CCAC's EMR. And so TouchAway is connected to the CRIS system. So when we have clients referred to Health Links, I set them up with their CRIS numbers into the dashboard. And then I also support them by deploying the tablets and conducting the evaluations that we're doing with the Women's College Hospital in Toronto.
Okay, nice. And personally, what do you mainly use the TouchAway for?
Personally, I don't really use it that much, but oftentimes I might need some sensitive information from care coordinators because we communicate multi-agency. And so sometimes you can't send things in emails because you have to either fax them or encrypt them. Okay. And so Aetonix is a secure channel. So especially when I need client information, I can connect with care coordinators and they can send me that information directly through the app. So awesome. It's saves me time. Yeah. And we skip a step.
Definitely. Yeah. And how has your experience been with the app so far?
Well, I've kind of seen it from many different angles. For sure. I've seen it from a training and coaching perspective where, I do assist in coaching new care coordinators how to use the app. I've seen it in its deployment essentially. So I've been with clients and showing them how to use it and how to set it up. So I've seen it from a lot of different perspectives, some good, some bad, and I think with every new technology, there's always some technical difficulties. Yeah. And so from that aspect, it has been a bit of challenge, but we've worked through it. Michelle and the team are a great team. Yeah. And, we've worked through that. But outside of that, I think the thing I like most about the app is how intuitive it is and how easy it is, because a lot of our clients are from an older demographic. So as soon as you bring new technology to their homes, they immediately get scared. It's like, I don't know how to use this, and I don't think I'll be able to use it. For sure. But once we set it up and I show them how to use it and they see that it's so simple, and then they start liking it, I think that's pretty rewarding. Yeah, so that's amazing. That's something I really enjoy. Yeah.
And last question. So what do you see in the future for the Health Links and a TouchAway?
Wow. Well, I think all the work that we're doing is definitely building onto something. I think that our clients are seeing the benefits in it. Care coordinators are seeing the benefits. physicians are slowly being engaged with it, and those who are on board, they see the value. So it's really a matter of people just hearing about the app, giving it a try, seeing how resourceful and valuable it is. And once that happens, I feel like there's nobody who will see this app, especially if they fit into the HealthLink population. So we're talking clients with comorbidities and complex medical issues. When they see this app, they see how it helps them, right? Okay. So I think the clients are going to drive the value of Aetonix. And so the ministry and all these other people will catch on later because clients are saying, this works for me. So I really see a future in the app. I see a future in Aetonix. And for HealthLinks, I mean, we do know that the ministry, that's the direction they want to take healthcare into. Yeah. And so I think Aetonix is in the right spot, the right time, perfect place, and a lot of people find value in it.
For sure, I hope so too. Yeah, well, absolutely. Thank you so much for being here with us today.
You're welcome, Amy. Appreciate it.
Thank you for watching, everyone. If you have any more questions for him, you can leave a comment and we'll get back to you.
All right, thanks, everyone.